80% of the people that are exposed to this virus do not suffer symptoms, nor are they taken ill. Of the 20% that are taken ill, some are taken severely ill. And of course, we have had in Washington state fatalities, and we pray that we'll avoid that here in New York. But no one can be sure of what may happen next. And as we give you the update at this point in time, our commitment to you and to all of the elected officials, both the Board of Legislators, our state delegation, our congressional delegation, is that we will share information in as realistic a time frame as we can. It's very important for us to be precise about the things that we can share and not share. There are federal HIPAA laws that do provide a certain amount of privacy to individuals in healthcare situations. And we want to make sure that we're realistic in communicating with you, but not creating a climate of panic and fear. But we're going to have to make decisions that, frankly, are not tied to spending a dime or a quarter. We're going to have to tell Sherlita and John and Tom and the other departments, do it. Just do it for public health purposes. We can't afford to give public health, on a tight situation. So knowing that there are resources available to us, and if this does become something more widespread that has a greater financial impact, then as we always do, we'll sit and talk with the board members, budget appropriations, and so forth, and understand how we handle the financial side of this. But the financial side of this issue is subordinate to the public health side of this issue. Yes.
The vast majority of people who get this infection are only mildly ill, so they wouldn't require a hospital. They could probably be isolated at home, as long as their home allowed for them not to expose others. And so only the most sick individuals would require, hospitalization, and we certainly are working with all of our hospital partners around this issue.
Peter?
In view of actually having a case diagnosed, have you taken another look at Westchester County Airport, the flights from overseas that come in there, and even domestic travel? And you could be doing anything?
Well, the overseas flights that came from any of those identified countries have to be channeled through JFK or Newark in this region. I believe that's still in force. Westchester County does not, the size and scope of the airport, subject of another press conference, does not really allow for any significant international flight. You might have a Canadian flight, or on the private side of the airport, a private jet flight. But even the private jets are under instructions, if they're bringing passengers from any of those countries, not to land in Westchester County, but to land at JFK to go through the appropriate protocol. We believe that's being followed. Now, if we do go to some higher level of alert and we start to curtail certain types of things, certainly the airport, along with our parks and recreational facilities and some of the other areas where the public interact with the county government, will be subject to whatever circumstances we make. There, our decisions are not made unilaterally. They're made in the context of the FAA, and there may be federal decisions, about air traffic that come at some higher level of concern. But we haven't reached that point. We're not even close to that point yet. So I think at this point, we feel, as everybody does, that the basic intercept coming from foreign countries, is adequate. If we see this become more domestically driven, and we see cases all across the United States where you can drive, you don't have to get on an airplane, then we're going to have to reevaluate exactly what we have to do. But Westchester's not on an island. We're going to be doing things in concert with other counties around us in New York State, and certainly New York State is interacting with neighboring states to try to determine what's the best strategy. All of that is happening amongst professionals, and those of us who are in the general government management business, once we're briefed, if we need to make decisions or make them in concert, as we've tried to do with healthcare professionals, then we'll let you know that we're moving to another level of concern or scrutiny.